How to make your eyes beautiful and avoid complications. Eyes look young because of volume. If you look at many well-known faces, you will notice how important the volume of upper eyelid is. Now compare this with people who lose weight very quickly and lose fat around the eyes. Skeletonization and loss of volume make a person look older. If we compare famous women of a similar age, none of them had aggressive eyelid surgery. Monica Bellucci looks the youngest largely because she preserved volume in her eyelids. You should never be deprived of volume, and extreme weight loss is also something to avoid. If volume is missing, it should be restored and the skin should be protected. One classic method is fat grafting, and if skin excision is really indicated, fat should not be removed, it should be preserved or even added. One of my favorite phrases is, "It is better to under-resect than to over-resect." Choosing the correct eyelid shape is crucial. Eyelid surgery is an operation where every millimeter matters. Removing even a small amount of extra fat or skin can dramatically change the look. A surgeon should model different future eyelid shapes and help you to choose the right one. For the same patient, several completely different results are possible, depending on the approach. Eyebrows matter more than you think. Very often, a sad or asymmetric look is caused not by eyelids, but by lowered eyebrows. This can be genetic or age-related, due to weakening of muscles and ligaments. A common mistake is removing only eyelid skin. The eyebrows continue to drop over time. And years later, the sad expression returns, sometimes even worse. If your eyebrows are low, the first thing to consider is eyebrow elevation. For the lower eyelids, it's essential to evaluate bone structure and fat volume. Sometimes it is better not to remove fat, but to reposition it to restore volume in the midface. Avoid unnecessary incisions on the lower eyelid. They can lead to ectropion, eyelid eversion, or exposure of the eyeball. Healing in this area is sometimes unpredictable, and surgical errors can happen. Sometimes everything looks fine at first, but problems appear 6 to 12 months later. Follow trends carefully. Always study long-term consequences and consider ethnic anatomy.